Welcome everyone to our end of the year celebration for Food System Horizons webinars. I'm really pleased to celebrate this time of the year with you guys because you've been with us along the way. Well, a few of you are also new to this. Some of you have stuck through the whole way through, and this is webinar number 10. Today is a really special celebration of the work that has been done around food systems, and what no better way to do that than to highlight the amazing work that VicHealth has done for food systems in Victoria. I'm really pleased that to have this privilege of hosting this topic and the speakers here, because as we know, through the decades and through all these great challenges that we actually weather through and try to solve, it's always really. Oh, my camera is not working. Sorry, my camera's not working, but you can hear me, right?
We can hear
You
you.
see my face. It's not working all of a sudden. I think during times like this, and when we're working through grand challenges like food systems, sustainability, and equity and nutrition, we know that you face barriers, you face change, but a lot of us know that you just have to keep doing what you need to do, and the system does find its way. And so that's what we're here for. We're here to celebrate the good things that have been done. We're here to look and reflect at what we can do better, and also how we can work together and continue collaborating towards these great goals that we aspire for, as a society. And with no further ado, I'm going to introduce the speakers today, speaker and discussant. And also, before I go into that, I want to start off by acknowledging the traditional owners of the land in which we meet. In Brisbane, in Meanjin, that's the Yagara and Turrbal peoples. And I'm really cognizant that, there are these peoples who have really gone through these challenges and found innovative ways to power through them. And I think there's a lot to learn from that. And I also, if you'd like to put in chat, the traditional owners and lands that you are in, joining us in from today, that would be a great thing to do. Before I introduce the speakers here, I'd like to acknowledge Vivian Yee of VicHealth, who was my co-conspirator in this sort of webinar. It's not an easy task, but we did it. And thank you for that, Vivian. She won't be speaking today, but hopefully she'll be asking questions and chatting through as we discuss. But thank you, Vivian, for doing this with me. I really appreciate it. So I'm going to introduce our speakers. Sharon Laurence. So welcome, Sharon. This is great to have you here. Sharon is manager of food systems at VicHealth, and she leads initiatives to strengthen equitable and sustainable food environments. Sharon has been around VicHealth for quite some time, and in Department of Health as well. She's a public health nutritionist and accomplished policy leader, and she has advanced population health through prevention and reducing health inequalities, fostering partnerships across sectors to drive systemic change and empower communities in shaping healthier food systems. Sharon's work spans community nutrition to evidence-based policymaking at a state and national level. Welcome, Sharon. Before you begin, I also want to introduce our two discussants who will be joining us as well today. Leah Galvin. Leah is a long-standing Food System Horizons sort of attendee and champion. Leah is a Churchill Fellow and consultant dedicated to reshaping regional food systems for resilience and equity. With a background in public health nutrition, she has worked across government, not-for-profits and communities to advance sustainable food procurements, food security and climate-ready strategies. Leah's expertise lies in public food procurement, stakeholder engagement, and regional development, driving initiatives that empower local producers and strengthen sustainable, values-based food systems in Australia. Leah is also working on a lovely national procurement project at the moment, and I'm really looking forward to the results of that body of work. Renae, likewise, has been a champion of food system and been supporter and a partner of Food System Horizons for quite some time. Renae Earle is a senior public health nutritionist and dietitian at Health and Wellbeing Queensland. Renae works with the remote Aboriginal and Torres Strait Islander communities to address food insecurity and health inequities. Her expertise spans food security, health equity, rural and remote health, obesity, weight stigma, and adolescent nutrition. Renae holds degrees in nutrition and dietetics, and I'm hoping she will say that she's already submitted her PhD. That's this week. Congratulations, Renae. Well done. And of course, I'll be hosting you, but and I won't take any more time. I'm going to hand over to Sharon to start the story. Sharon, over to you.
Thank you, Lily. Can everyone see the slide? Yes, all good. Thumbs up. It's a real pleasure to be joining you today, and it's an inspiring story. It is truly, and when you start to put together a presentation like this, you're awestruck by the contributions, the layering over the decades that VicHealth has been a central part of with partners over that time. And it's a real honour, actually, and to speak to this today and have this opportunity among so many colleagues and friends and all of you here today. So I thank you for the acknowledgement, Lily, and I'm coming to you from the Wurundjeri, for the land of the Wurundjeri people of the Kulin Nation, and I wish to pay my deepest respect to elders past, present here today. I also really want to acknowledge what an historic time this is in Victoria. So we passed through our Parliament the first treaty for Australia between the Victorian Government and the First People's Assembly of the countries of Victoria. So this is significant. Also this week there was an historic apology in Parliament in Victoria to the First Peoples of our state. And I think for those in health promotion, this is really core, and this, when people have a genuine say in the conditions that shape their lives, they experience greater wellbeing, connections and outcomes. And that's what treaty is all about. And so I do want to take a moment just to acknowledge what an important line in the sand this is for a new path together in this state. So VicHealth, my goodness, 40 years. And this is how it was established. Under the Tobacco Act in 1987, with a mandate to promote good health for all Victorians. VicHealth was the first health promotion body in the world to be funded through a tax on tobacco. It's been independent, and it's been a model that has instigated health promotion bodies across Australia, across Asia, from Singapore, Malaysia, Tonga, Austria to Switzerland. So we have a jewel in Victoria, and that is VicHealth. There's so much I could speak to about VicHealth, but today we're going to tell the journey that is less known, I think, around food systems change. So the purpose of VicHealth is enduring, and it's to eliminate the barriers to good health, working with Victorian communities who face the greatest systemic inequity. So our role at VicHealth is to use our influence, independence relationships, voice and expertise to reshape systems to improve health and wellbeing for all Victorians. We work across all levels of government at VicHealth. We work with peak bodies, research bodies, academics, and really importantly, with community. So I like to anchor a talk like this in the three big issues: food systems for health, equity, sustainability. We know that fresh food is harder to access and particularly prioritise. So we talked about VicHealth's origin as, you know, starting when tobacco was a leading risk factor for disease, and now it's obesity. And followed third by dietary risks. 1/3 of Australians' energy is now coming from unhealthy discretionary foods, and this accounts for more than half of Australia's packaged food supply. And yet we're not eating enough of the good stuff. Only 4% of us are eating enough vegetables for good health. Really interesting work, though, in Western Public Health Unit across 10 local government areas. They found that just by increasing one extra serve of vegetables per day for 51,000 children across those Western suburbs would result in savings of 182 million to the health system. So it's stats like this that really show how important this work is, but it's also how achievable it is. And that's what continues to inspire me. The flip side of this too is that we're dealing with increasing food insecurity. VicHealth's been on food insecurity for decades, but it is actually getting worse in Victoria. 1 in 4 Victorian adults report being worried about running out of money to buy food. So we know that that compromises the quality of our diets. Underpinning all of this, healthy and more sustainable food systems are critical, as we know, to climate change mitigation and adaptation. So it's these three anchor points that guides the work at VicHealth in its systems approach: food for health, food for equity, and for sustainability and environmental outcomes. So we've embedded this in a 10-year strategy, and there's not a day that goes by that I do not value food systems being one of the 3 top system priorities for this organisation. And that is an achievement, and that will endure. So, you know, this is our strategy. We have neighbourhood and built systems as well, commercial and economic systems, of course, of which food is a really central part as well. Equity is embedded in everything we do at VicHealth. So I could choose many food system maps here, but I like this one. This is from Francesco Branca and his colleagues at the World Health Organization, who actually visited Victoria in recent months to look at close at hand at some of the initiatives that VicHealth is supporting and innovating on the ground. I like this map because it shows the leverage points across the system where we can act to do 2 key things: to increase access to nutritious food, particularly fresh fruit and vegetables, but also where can we put the brakes on ultra-processed food? How can we lessen the impact of that? Because we know that is the dominant food available now in settings where we live, work, learn and play. So at VicHealth, we work, we advise, we work with government, and the Victorian policy context is really important here. And in terms of VicHealth's journey within Victoria, the policy cascade is important here. So we do have a Victorian Public Health and Wellbeing Plan, a requirement of our Public Health Act, and there are key priorities in that: increasing healthy eating, also tackling climate change and its impact on health. So we utilise those statewide priorities to give power to the work we do at VicHealth. And you can see the highlighted action is where VicHealth is currently putting its attention, promoting healthy, more equitable and sustainable food systems with a particular focus on priority groups. So that guides our work. The other really important thing about this policy context in Victoria is that it guides what local government does as well. We've got 79 local governments in Victoria. As part of the Act, they also have to do municipal public health and wellbeing plans. The local governments in developing those plans are guided by this state plan. So there's a really big opportunity. We also have good data in Victoria, and this is sometimes not known well enough, but it's really critical part of our prevention infrastructure. And this has been long-term. So we have the Victorian Public Health Survey, Population Health Survey, that occurs statewide every year, and also drills down to the local government level. We've had food security questions in this survey, at least since the first question there since 2006, and more recently, the second question. I can see a few people in the audience here that were instrumental in advocating for the importance of these questions to be in this survey. And, you know, no data, no problem. We have the data. This is really helpful to guide action and prioritisation of this work across the state, including at the local government level. So just the top line things that VicHealth is doing now in food systems, and I'll dig down into some of these in a bit more detail. We fund research. We fund groundbreaking research in public health in food systems over the decades. We also support our local governments, and we have been doing that too over the decades, shaping, supporting, understanding the leverage points, the role in addressing food insecurity and other health issues at that local government level, at that community-wide level. We support funding usually around 3 to 5 years. We also support small grants, which I'll talk to, but we seed and scale and test things that are implemented, and there's been some tremendous success stories. We're supporting First Nations food systems, particularly self-determined strategies within Aboriginal community-controlled organisations. We have a really wonderful partnership, a strategic partnership with the Stephanie Alexander Kitchen Garden Foundation. That's an organisation across Australia. Our support from VicHealth has really boosted the implementation of that across 450 schools in priority communities in Victoria. They also work with Aboriginal community-controlled organisations, and that's really getting in early, supporting their established program, shifting those norms. Taste, share, cook fresh food is a really wonderful program. Advocacy and sector convening on the shared priorities, such an important, often hidden, but important role of VicHealth and its independence. And I will talk to that further now. So just thinking about this journey though, we haven't got here overnight. This has been incremental, it's been multi-layered, and so many partners over the decades have supported this strength, rich and sophistication of the work in food systems and food security at VicHealth and in the state of Victoria. It started with Food for All, and I know that's the people on the call that were involved in Food for All from 2005. Food for All was the first funded initiative supporting really at-need local governments to understand what they could do at a community level to support better food security. 10 ways local government can act is the title of that. It's probably a little bit small to see, but that started it off, and we're still building on that work. We funded the Food Alliance, probably a bit before its time, in fact, but that was a really important precursor to what is now Sustain, a thriving peak body for advocating for local food systems change. And we continue to partner with Sustain in the work we do at VicHealth. Open Food Network, I mean, amazing contribution. Everyone's probably encountered the work of the Open Food Network without even realising. So VicHealth, they established the seed funding for Open Food Network, I think back in 2006. So Open Food Network was the first online, was a digital infrastructure providing an online marketplace to directly connect food producers from small regenerative farms to consumers and other independent community enterprises. So that technology is often what powers your local food fruit and veg box schemes all around the country. They're now connecting with 2,000 producers across Victoria, across Australia, and globally as well. So really, from little things, big things grow. And this is the sorts of things we've seen in VicHealth over the decades. Then we move on to 2020, and that was COVID. And I remember this period well. VicHealth at this point played a really critical role. They supported a convening of a range of peak bodies in Victoria to come up with this important piece of work, which is titled the Consensus Statement. Remember, many of us in food security have been aware of the issues for so long, and yet COVID really brought it to the public sphere. It became acute for many people, and a kind of a moment that we became aware that our food system was broken. So the consensus statement was important to get these various people together on those shared priorities and really articulate, again, 10 key actions that we can all agree on in a more sophisticated way that enabled us across various organisations to submit powerfully to a number of subsequent advocacy opportunities, parliamentary inquiries, and there's a few of them there, but there's been 2 parliamentary inquiries into food insecurity in the Victoria Parliament, food supply and food insecurity, and many hundreds have been submitting also to the Feeding Australia national strategy. So that's the journey, leading by convening, supporting, investing in promising work, and that has occurred over the decades. In recent years, we've funded food hubs. These food hubs, many continue to exist. The funding has recently been completed. 7 food hubs across the state, and these are really important in supporting regional and outer fringe communities, often from very culturally marginalised communities, to support, understand and connect through food in a range of settings. So we learn a lot from these food hubs, and really this work has enabled us to strengthen and expand the journey in food systems change in a recent investment, which we are calling Local Partnerships for Food First. So again, the same outcomes we are looking for in this investment: food for health, for equity and sustainability. In Local Partnerships for Food First, it's a $6.5 million investment over 3.5 years, and it's lifting up and supporting often the really good work that we knew that was already happened, but it's often volunteer time, but really emerging. We at VicHealth want to kind of give that something. We want to profile it. We want to improve the capability and the scale. So this is the vision, and this is the vision. The vision is important because as well as the data, we need to connect the hearts and minds. So I'll read this out, but I think it'll ring true for everyone that is both passionate but also really academically and professionally engaged in this work over so long. Putting food first reimagines how we value, connect with and access food. Food is more than what we eat. It connects us to culture, to country and to each other. It's the foundation of good health, strong communities and a thriving environment. So this is the food first vision that underpins our current work at VicHealth in food systems. We're using the methodology of collective impact, and we're funding 9 partnerships which are delivering collective impact through partnerships with sometimes 6 or more organisations at the local level, and then we're bringing them together at the state level for that statewide collective impact to cross-fertilise, mutually reinforcing good ideas and enabling the scale of those, to giving profile, to learning from each other's mistakes. We've got quite a sophisticated backbone support for this collective impact. We've commenced an external evaluation team that has started right on time with the beginning of the investment. We have a fifth systems change facilitator. We have Serenity Hill from the Open Food Network, who's supporting and mentoring these local partnerships along this journey. And we have events. We have online digital gatherings through the Sustain Australian Food Network digital platform. We're also bringing people together a number of times a year and bringing them together with the broader sector as well, sharing those learnings more broadly across the state under the umbrella of Food First, supporting what has been in play for so long, but this first food kind of movement. So across the state, there are some of where these partnerships are located. And I think what we're trying to do here is support distinct models of change, again, that show promise. Some will fail, some, but that's the space we're in. This is new work. Some of the models you can see are firstly a social enterprise model that's supporting change and supporting school meals in schools. We are looking at procurement, and Leah's going to talk about this later, but procurement, I think, is such the promising way to really step up local food system change. And so we're excited in the Western Suburbs to be supporting a partnership that's across 11 local governments, going to look for solid models to support healthy, sustainable food into early childhood services at scale, and aligned with nutrition policies in that setting at a critical time of life. Community food enterprises, food hubs, mobile grocers, micro and social enterprises, small-scale farming programs, producing food for sale, including Farm My School, so upturning the school oval into a market garden. In fact, there was an event around this just a few weeks ago, absolutely amazing, 500 volunteers gathered to turn the school at Colac into a gardening, and Costa was there. Incredible energy and enthusiasm from the local community around this. And again, an interesting model that wouldn't you love to see that be replicated throughout. Self-determined projects from First Nations communities, culturally and racially marginalised communities, and again, the digital platform through Sustain. Aside from the longer term grants, we also at VicHealth have lots of small grants. In fact, with 9.57 million over 2 grant rounds has gone directly to communities. And a good half of that's been in local food systems. Some incredible some initiatives there. And what we really like to do is make sure that, as much as we can, we're supporting strategically those small grants to connect up and build over time. And I just love this example. And another jewel in Victoria is our community grocer. Seed funding over the years at different points from VicHealth has helped this really innovative social enterprise that does pop-up markets in public housing, selling fresh, delicious food at 30% less than neighbouring stores. They have grown from a couple of sites to now 6 sites and have just celebrated 10 years in operation in Victoria. So another wonderful example of from little things, big things grow, but really demonstrating what is possible in local food systems change. So that's a quick survey of the decades, and you know, again, struck and inspired by the stories, the work, the dedication by so many partners that have contributed to this story in Victoria over time. And so some of the key themes, I think, the role of VicHealth, but also the way forward in shepherding and changing and supporting this work over time. Firstly, promoting strong cross-sector convening and that increasing sophistication of developing those shared priorities that we all attach to and advocate and work towards and support, working together. Taking a systems approach, and you know, that's what the CSIRO report, Food Horizons, was about. We can't work in a silo on healthy eating now. You know, we can't just work in our own corner. We have to bring food together for health, for equity, and for sustainability. Be adaptable, changing, but taking that systems lens. The system will find a way. I love that, Lily, which is something you said right at the beginning. And a systems approach is certainly powerful. We need to work in partnerships. We need to amplify collective action with equity at our core and bring our communities along with us and support them. And lastly, and I think where this is where VicHealth has really been outstanding over the decades, it's bravely backed promising models that have really been lifted up and, you know, and I've shown, I hope, some examples of how they have become really important part of our food system infrastructure, not just in this state, Australia, and even more broadly. So this work is not going to end. It's going to go from strength to strength, and I just, I'm, you know, really pleased to speak to some of it today. So that's how you can contact us. Thanks, Lily.
Thank you, Sharon. That is amazing, and thank you for taking us through this journey. When I was talking to you guys and preparing for this webinar, I was struck by the history that backed this story. And I think it's really important to note that the successes that we celebrate, the achievements that we have, are not just off the back of recent sort of effort, but decades of work.
Decades of work.
Leah, I think that's the bit that we cannot forget. It takes a long time to shift the dial, and it takes a significant amount of investment and time and resources and energy and passion and commitment to actually get this happening. But I'm going to pass on to our two discussants, Leah and Renae. We didn't talk about who goes first. But I'm going to put you both in the spotlight and just share your thoughts on, you know, what does this mean for you? What does the work that VicHealth has done mean for you? But also, how does this reflect in your spaces? I'll put Renae on as well.
Happy to jump in. Sorry.
Go for it.
Thanks. So Leah Galvin, I'm joining you from Nipaluna, Hobart today. Thanks for the presentation, Sharon. I feel like I've just had like a walk through my professional career.
You've been a big part of it, Leah.
Well, no, I've been lucky, very fortunate to be part of the pioneering work that VicHealth has done. Right from Food for All, I worked as a project officer at the City of Greater Dandenong. We had a key focus on new arrivals and refugees. That was because they were one of the most marginalised groups and most food insecure groups in that location. But I was also thinking, as you moved through those slides, how we started off with household and sort of individual level food security, and then it became more systems focused in the 5 years after that. And really, for people that were involved in that food security work, we were also transitioning our thinking so that we understood how much systems were actually impacting on these issues at a household and sort of community level. And it created this, you know, amazing ecosystem of people with expertise and knowledge, and really connected us into a new way of thinking. Which was really critical, because I came to this work as a public health nutritionist. I'd done food security in my honours, and really where I've ended up doing my work now is really quite different from where I started, and so much of that parallels with the new knowledge that VicHealth has created along the way, those ecosystems and connections that you've created as well to help us expand our thinking and our work and our advocacy. So awesome. I wanted to talk a little bit about how there are still parallels, just really quickly, and that's because in VicHealth's, in your strategy now, you have food procurement, and I'm thrilled to have seen that purposeful food procurement as part of the big systems work that you want to do in the longer term. You kindly mentioned that I've been working on a project. I want to acknowledge some of my colleagues that might be online today, particularly Erica, who provided us with a beautiful policy brief and framework for thinking for that project. So what we were working on was actually mapping food procurement, so the money that governments spend either in institutions or in programs, and what that looks like across Australia in various settings. We've also had a look at how the system operates. A lot of it's been how do things work, you know, including very dry areas like contracting, but it's important to understand those things if you want to influence change in a setting. My colleague Steph Godrich did a really beautiful review of a whole lot of policy documents so that we know what the enablers are from a policy perspective. Erica and her colleagues made a contribution to that as well, doing a review for us here in Australia. And then Deepa, who's ex-VicHealth, made a great contribution to this report as well. It's a really massive body of evidence that we've created through this project, and she looked at a variety of different scenarios based on overseas models and what we could hope to achieve if we set ourselves some goals and targets for leveraging food procurement as a food systems change tool, which it most definitely can be. So I love that there's these parallels between where VicHealth is, how it's influenced how we think, and pushed us to think about new ways to, through our passion and our efforts in our work, to really change food systems. So a big congrats to VicHealth, and thank you for helping drive us all forward.
Thanks, Leah. And thank you, Sharon, for such a great presentation. 40 years of VicHealth, that's quite amazing. And yeah, your presentation really demonstrated the breadth of work there. Health and Wellbeing Queensland, we're set up similar, but we're only 6 years old, so we're babies in comparison. And we've often looked to you guys as the big brother or sister, as the leader, and been following your successes. So yeah, congratulations to the great work and paving the way for health promotion agencies. I'm a senior public health nutritionist from Health and Wellbeing Queensland, and I'm a dietitian by background, but the last 4.5 years I've been working on the complex problem that is food security and extending my work and learnings in the food system space. And this has taken me to some places that I didn't expect, from policy development to advocating at parliamentary committees and working with colleagues from agriculture and supply chain and transport. It's not where I expected to be when I trained as a dietitian. I thought I'd be sitting in some clinic somewhere telling people to eat more vegetables. But the longer I'm in this space, the more I realise the role and the importance of public health nutrition in this cross-sector environment. So our agency's remit simply is to prevent chronic disease and reduce health inequities. We want to keep people healthy and well for as long as possible and to keep them out of hospital. And we all know that food security is essential to that. But not only the nutrition lens, we mustn't forget that food security is an internationally recognised human right, the right to food. And I can see that come through really strongly in that right to food lens come through really strongly in the work you've presented on, Sharon, because it's about how our food systems can support people to exercise their human right to food. And we know that not everybody in Australia has that opportunity. And that idea that every Australian should have access to food is not a tough selling point. It's pretty easy for people to agree on the fact that we should be able to afford to feed our families. For me, as a dietitian, it's very easy to get bogged down in the, stats around food security is associated with cardiovascular disease and type 2 diabetes and iron deficiency anemia, all those things that worry me. And those things are very important, but they're not necessarily the messages that are going to land with the food system stakeholders that we need to work with if we're going to make meaningful change. We know that the things that hold food insecurity in place are complex. We mapped them in Queensland with remote communities, and we ended up with a framework that included things like hunting laws and school curriculum and economic development, land rights, water rights, workforce. Like, yes, nutrition education, food budgeting, cooking skills were all there, but they were only a part of the story. And that tells us something important, which is that many of the influence over food security sits outside of the locus of control of health and outside of the remit of any single agency. So we need to work together. And that means looking in unexpected places for alignment, establishing the right partnerships and governance, and leaning on our colleagues and champions in other sectors. As Sharon said, I loved the leading by convening. That's what we try and do here in Queensland as well, and is exactly what we're trying to do through our Gather and Grow program of work, which is pulling together the agencies with a stake in food security. We've seen some success in that work. We now have an action plan that has the support of 17 different government agencies across all tiers and the backings from stakeholders from the non-government sector too. But common theme here, that success was built upon decades of advocacy, engagement and hard work by our dedicated public health, nutrition and health promotion workforce. My director, who's been in this space a lot longer than I have, will often say to me, we used to try to talk to these people about food security, but they didn't really want to talk to us. And now they're inviting us into their forums because they can understand and see the relevance. And being in those cross-government spaces that maybe are a bit scary, like an essential goods supply chain working group or something like that, are the types of spaces we need to occupy as public health nutritionists if we want to garner the right momentum and support. For us here in Queensland now, I suppose our challenge is maintaining that momentum in an ever-changing environment, which is, the only thing that's constant is change. And I expect that will probably come up in the discussion around context. So I'm happy to leave it there. Thank you.
Thank you so much, Renae. Before I open up the discussion and hold recording, give me one question, please. I have just one question for the three of you. And it's really about what you talk about there, Renae. I'm really intrigued, and I'm seeing this. Language matters when we're trying to shift this sort of space. Priorities and the disciplines that we, come from, but also our KPIs, they matter. From the different departments that we represent. In some instances, the food system is a lever for economic development. You guys have come from a public health and nutrition and equity perspective. And for some stakeholders, that is not high in their priority rankings. Economic development might be higher. What is your advice? And that's not necessarily wrong, because we have different goals from the food system. Like that's us, that's humans. What is your advice in getting different stakeholder priorities to come to the table even? I'm not even asking about alignment yet, but just coming to that table so that we can actually have a discussion. It looks like you're already starting to do that, Renae, based on what you talked about. But I'm sure, and Sharon, you've also talked about this with me before, where it'd be nice. It's good. You mentioned that, I had a supply chain background. Maybe we should talk, that kind of thing. So nutrition is newish to me, and I'm not like you guys have been living and breathing it. How do you get people to come together?
I can kick off if you like. Great question, and kind of what we've been living and breathing over the last 4.5 years with Gather and Grow. I think it is an exercise in taking a step back from the ego a little bit and allowing nutrition to be a part of a broader agenda. Because if you think about the people you're talking to, it might be agriculture, climate change, wherever they are in the food system. If you look at what we're trying to achieve, if you're talking to the right people, the end goal is the same. We're just looking at the problem through different lenses. And so allowing those lenses to coexist with the nutrition lens and not kind of, I suppose, trying to make it overshadow other things. It's really important that nutrition is fundamental to everything we do, absolutely. But in order to be able to establish those right partnerships, you need to be able to understand what your nutrition lens can bring to their problem. And the other thing that we have been doing in Queensland in particular is trying to understand the motivations of like a whole of system sector, a whole of government system, and tie food security to that. So what is the whole of government focused on? What is the priority of the day? Is it cost of living? Is it Olympics? Is it closing the gap? Is it economic development? And how can you tap into that from a food point of view? The thing about food is that it actually touches a lot of different things, and the impacts of food insecurity are pervasive across multiple life domains. You've got school attendance, academic outcomes, domestic and family violence, mental health, economic outcomes. So we can use that to our advantage, I suppose, in being able to position food as a mechanism of a solution rather than being a barrier to something that another sector is trying to achieve. I think that is one of the ways that we've been able to have some gains in Gather and Grow, but I'm sure there's plenty other ways that others might do it in other states and territories.
Yeah, I'm happy to build on from that, Renae. I think I'm a public health nutritionist as well, and I think in most of my early years had a fairly focused nutrition language, purpose and value that I brought to every initiative and every collaboration. I think I have seen the power of taking a systems approach and focusing and bringing not just healthy eating, but climate change and equity together. I've seen that is actually a vehicle to bringing more people to your cause, even if that was around healthy eating. And a great example for me was when I did work in the Department of Health in the state nutrition policy area. We got across the line a procurement policy, Leah, for catering, so that a healthy and sustainable public spend for the money that departments spend on catering, which is a lot. It's a lot when you mount up 9 government departments, central offices, regional offices. So if we were to go and put the case for healthy catering based on only nutrition and the burden of disease, we would have got some people to support the cause. But when we worked with our climate and health colleagues and made it not just healthy food, but actually sustainable food, and when we joined up with, getting rid of single-use plastics and took on those other issues as well, we got a whole lot more support from our department colleagues across government. And then when we did an economic analysis of what a shift to healthy and more sustainable catering would be, and found that it actually wouldn't cost more, we brought all the finance people along with the cause as well. I can't tell you how much money we saved the department getting rid of the cream biscuits that were eternally just available in staff cafeterias, would you believe? You know, so they were very happy with us, the procurement people. So my point is that when you broaden your scope, you take a systems approach and you build in the triple value on these policies, you get more adherence than you would otherwise have if you were just coming from a nutrition perspective or a sustainability perspective. And
I couldn't agree more. And that's actually probably one of the reasons I really love working in the procurement space. And in this project that I mentioned, you know, in our scenario planning, we very deliberately looked at, you know, evidence from overseas to see what the health and equity impacts could be, you know, what the impacts could be on regional economies, what sort of reductions we could look for in climate emissions and how we could improve biodiversity. Yeah. And it's such an interesting area to work in because actually everybody wins.
Everybody wins.
So it makes it easier to bring stakeholders with diverse agendas to the work. And I think that's one of the reasons why I really enjoy this procurement space. Absolutely. Because the co-benefits are so strong. And as long as we take the effort to bring other people, and I love that story, Sharon, that was so interesting about how you could bring other government departments along. But similarly, when you're working outside of government with actors across the food system, you can bring them along and achieve all of these co-benefits as well. And the economic one particularly, often we have to frame these issues in that way. To get people's attention initially. And I have to say that what we found when we've just been doing this project is about the enormous multiplier of benefits that are can be created in regional and local economies through a more sustainable approach to food procurement by institutions and programs funded by government. So we really look forward to sharing that very comprehensive piece of work with you in the first quarter of 2026. But I really feel like this is how we need to do food systems work as much as we possibly can. Often actually in institutions, ironically, it's the health bit that's the strongest because, of course, menus are often designed around, you know, the Australian guidelines to healthy eating, for example. So we're really asking through procurement for these add-ons to think about economic development and to think about climate. And we know that there's strong support in the community to do that work. So, it's a little bit the other way around. Yeah, and I think absolutely. It's that co-benefits approach. And the co-benefits, I think, is a really good word around how to frame that as well. And, what is it we can all agree on and multiple co-benefits just enable these initiatives to scale and engage far more broadly. Yeah.
I realised I was on mute and I was talking to myself. I was thinking that actually these co-benefits make it stick. You talk about adherence, Sharon, and I think that's so true. It makes them last longer when you've got multiple stakeholders buy-in in there. I am now going to pause recording and open up the discussion to the room. So I'll ask people if you're happy to turn your videos on. I'll switch recording off. Thank you for those who will be viewing this later on.